If you'd like to know what the most powerful natural tool is for controlling your blood pressure, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about the most powerful tool you can possibly use to manage your blood pressure. You may not like the answer. It's perfectly natural, it's safe, it's quick, but it's not for everybody. But there are some takeaways from this that can be important for you and what you can use in your life. The tool is water-only fasting. Now that sounds pretty simplistic, but let me give you the results or what happened in this particular study. This was actually a chiropractor, Dr. Goldhammer, that had been doing this for years, and actually moved into doing this in a inpatient medical setting, so everything could be monitored and recorded. And so this was done on 174 patients over the course of a period of time that they used them as examples whenever they met the criteria for the study. And they did water-only fasting. So basically the first 2 days, preferably before they came to the center, if not at the center, they would be limited in their calorie intake and only taking in fruits and vegetables. The water-only fasting portion was just that. Water only, limited activity, and the average time is about 10 to 11 days. So that seems like a lot of water-only fasting. The author was quoted as saying he was surprised at how fast hunger went away, because people generally think that hunger would be the biggest challenge, but that went away relatively quickly, and that wasn't the big concern for the people in the study. After the study, they were transitioned over the next 6 or 7 days into a low-sodium vegan type diet. So the idea was to move them away from basically clearing out their body and then moving in with a very clean diet. My personal thought about how this works is twofold. Is A, you stop putting the crap in your body that affects your blood pressure. So that's the first part of what probably happens. The second part is it gives your body a chance to calm down and start to break down and process and eliminate some of the junk and chemicals that you've been accumulating over the years. So it's probably a balance between those two is why this is so effective. So then when we talk about effective, let's look at how many or what actually happened in the study. 90% of these patients were able to achieve a blood pressure under 140 over 90. The average response, the average blood pressure drop was 37 points systolic on the top and 13 points in the bottom. That's the average. Like most medications can't drop blood pressure that well, especially in 10 days with no side effects. The most striking thing with this is the people who had the most severe high blood pressure. So stage 3 hypertension, so 180 systolic, 190 systolic, or I'm sorry, 110 systolic and above. The average systolic point drop was 59 degrees or millimeters of mercury. 60 points. That's a huge change in a matter of essentially 2 weeks. These people were able to get off of their meds from being near stroke risk. Diastolic change in there was 17, so 60 points systolic, 17 points diastolic. This was fixing the problem. This wasn't a temporary patch. This was a matter of getting the body ready for or clearing things out, stopping putting the crap in, and allowing blood pressure to come back down to normal. We hear all the time that people say, well, it's just genetic, I can't do anything about it. That's irrelevant. Genetics play a small role in what happens with blood pressure. If not, when you were 10, you would have had elevated blood pressure, and that's almost never the case. So the question is, most people aren't going to do water-only fasting for 10 to 11 days, even though it's an incredibly powerful tool. But I've talked about intermittent fasting and how that can play a role in decreasing inflammation, weight management, overall healthy lifestyles. So we could certainly incorporate some degree of intermittent fasting instead of water-only fasting. But either way, those are important tools and incredibly powerful at lowering blood pressure down to normal levels. Interestingly enough, everybody who was on medication, there was a small chunk of people in the study that were on medications, were off their medication at the end of the study. So that says something about this. So to say that blood pressure can't be fixed and you've done everything, that's not true. Unless you've done water-only fasting and this didn't work for you, then I would accept that, wow, you really did try everything. As always, I'll post a link to this particular study in the comments section. And make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.